Nurses in this hospital in Johannesburg are struggling to keep up with the intake of Covid-19 patients. Back in April, the isolation room filled up so quickly that those infected had to be put in ordinary wards. On these images, only a curtain separates them from other patients.
In our facilities, in our hospitals, COVID-19 cases are all over the place. There's no ward, by the way, that doesn't have a COVID-19 patient. The nurses are testing positive as well, and it's a mess.
Nurses say that 240 members of staff have caught COVID-19. Like many across the country, they've complained of a shortage of protective gear to tend to patients. This as the country has been rocked by allegations of corruption to fight the outbreak. Cases have risen over recent weeks after lockdown measures were lifted before the virus had peaked to avoid further damage to an already shrinking economy. Now past the 500,000 mark, the number of deaths remains lower than the global average, with 8,100 recorded fatalities. But despite widespread testing, social stigma remains a barrier to stopping the spread of COVID-19.
I've heard people saying, I'll never test for corona because I know how I would be treated. Some, they even say from my family. Some, they would say it's obvious in the community.
Now the world's fifth most affected country, the World Health Organization has warned that South Africa may be a precursor for other outbreaks across the continent.